Alright, so liver hepatitis. So basically, the liver's function, so liver produces bile, breaks down fat into small droplets, stomach so the stomach can digest it. It processes nutrients. So basically, it has the hepatic portal vein where you get a lot of nutrients but not enough oxygen, but you get the hepatic artery where you would have a lot of oxygen but no nutrients at all. But converts glucose to glycogen, so you get the pancreas to come here to get glucose and mix it into glycogen so you can store it for later use. But carbs are needed to make energy for cells of the body. So liver regulates blood glucose levels, so too much glucose can cause nerve damage, blood vessel damage, and diabetes type 2. It detoxifies, so alcohol. So if someone has an alcoholic situation and it's effing up the liver, then you can't detoxify anymore, and alcohol actually becomes a problem and it toxifies the blood. Converts fat-soluble toxins to water-soluble form to pee out. So let's say fat-soluble would be ammonia, and water-soluble would be urea, and that would be peed out. But if you have CKD and water-soluble, it stays in that form, stays even more becoming a toxin, and I don't think that it would be helpful if you have so much protein, and it's so much protein that causes ammonia to be turned into urea. So with someone that has CKD, it's important to limit protein intake as well. Stores energy as glycogen, stores iron, copper, vitamin B12, and fat-soluble vitamins like EDEC. Makes blood clotting proteins. Vitamin D and vitamin K, very important. Vitamin D for bones, vitamin K for bleeding, so leafy vegetables. And then vitamin D only gets activated if the hormone from the kidney is released, vitamin D hormone to activate it. Makes blood clotting proteins, so blood plasma proteins, transport proteins, all these proteins that carry fat and soluble vitamins. Produces hormones, basically. It eliminates excess hormones, so estrogen. If it's not able to eliminate estrogen, it gets a buildup of estrogen. You get hella like man boobs, low testes. You'll have irregular periods for women, or no period even. And important especially is that it breaks down and recycles red blood cells. So that's very important. So if kidneys are producing hella red blood cells because it causes erythropoietin, then you're gonna have no breakdown. You're gonna have a lot of red blood cells going on in your body. Okay, so vascular functions. There's Kupffer cells, basically, that are basically that macrophages of the liver. They screen the pathogens coming in. You get a portal vein for nutrients and oxygen from deoxygenated from spleen, liver, and stomach. So all of the veins, gastric veins, portal veins, blah blah blah, drain to the portal vein, go into the actual liver, and the actual portal artery comes from the inferior vena cava of the heart, and it goes into the liver as well to give oxygen. Sinusoid blockage, cirrhosis. Portal vein hypertension due to fluid buildup and leaky vessels. Pathogens, oxygen, nutrients, filtration, stomach, spleen, intestines backing up, pancreas, obviously glucose. Yeah. And then secretory function, so it produces bile. Yeah, liver makes bile, gallbladder stores bile. So it breaks down fats typically digestible, hepatocyte the liver cells, duodenum, cholesterol, fat packaged in bile, and sent around body as lipoproteins, HDL, LDL. So it helps with it basically makes cholesterol. If it's good, liver excess taken to liver and gets excreted out, but if it's bad, it gets delivered to tissues and it's not good. Liver makes bile, but gallbladder stores bile, closest to kinin, cystic duct, common bile duct, bile salts, emulsification of food to actually become absorbable in the stomach, feces, eliminates ammonia buildup, lactulose reabsorption, vitamins, processing bilirubin. Liver and spleen break down old red blood cells, so that becomes bilirubin. Old red blood cells broken down becomes bilirubin. And then when it's unconjugated, a breakdown of old red blood cells become unconjugated bilirubin, yellow color. And the whole point is to make them conjugated to be peed out, but if it stays unconjugated, that's the reason it becomes yellow. Red blood cells. Water-soluble RBCs, unconjugated brown, direct. Hepatocytes then convert unconjugated to conjugated, so then it becomes water-soluble, you can pee it out. And if you can't, and if it unconjugated means that it's not water-soluble, you can't pee out, you need to poo it out. Okay, so liver is a buildup of ammonia and bilirubin. Liver feces, because chemically group then breaking down red blood cells, some stores as bile resorbs to get eaten and digested by bilirubin. Buildup of unconjugated bilirubin travels on albumin and ends up in adipose tissues of hypodermis of skin. You get hella itchy from this, and you get itchy from ammonia as well, or pruritus from uremia, actually. Crazy. Nutrient storage and processing, you store excess stored in liver, sugar, fat, and protein. Glycogenesis, basically storing and making sugar from fat and protein. Sugar, fat, protein. Glucose, fat, protein. Glycogenolysis, or breakdown to make of stores, and making new sugar from fat and protein. Lipoproteins transport fatty acids, metabolism, albumin, fibrinogen, globulin, vitamin K, clotting factors, vitamins, and ferritins. Fibrinogen, liver makes these proteins found in blood plasma, all these proteins actually. And vitamins is stored in liver with the help of iron. Liver activates fat-soluble vitamins. Drug detox basically turns hormones on and off, so it increases estrogen and man boobs. Toxins, urea, fat-soluble. Excretion, alcohol is water-soluble, flushes out due to inflammatory response. Bile, water, ammonia. Byproduct of food, usually converted to urea, excreted by kidneys. It's a byproduct of protein. Buildup leads to hepatic encephalopathy. So I'm just going to do a little bit of the idea of liver. Very important to hepatitis, you need to vaccinate. Liver hepatitis, any type of viral hepatitis, less than 6 months, anything more than that is chronic, and you can also be asymptomatic. Liver inflammation is when hepatocytes swell up, hepatomegaly, hepatocyte death equals scarring and fibrosis. Signs and symptoms are fever, appetite loss, nausea, abdominal pain, jaundice, yellowing of skin and eyes, dark urine, amber urine, unconjugated bilirubin, light stools, hepatomegaly, so fatty stools, enlarged liver, right upper tenderness, distended abdomen, palmar erythema, vomiting, sputerangioma. Alright. Yes, so we talked about this already. This is from the left ventricle, and this gives you oxygenated blood to the liver. And then anything from here in the stomach will go into here, and this is the hepatic portal vein. And then surprisingly, the artery, which is away from the heart, is in here. Gallbladder stores bile, doesn't make it. Liver is the one that makes it. Bile duct stores glycogen. Deoxygenated blood from stomach, spleen, liver, intestine goes to liver. If it's not working out over here, it all gets backed up into the spleen. Everything gets backed up and it goes into the IVC. It goes into the esophageal. And then you'll see gastric veins. It goes everything here. Splenomegaly, ascites, ascites, back of splenomegaly, oxygen blood, whatever. Big bloody sponge. Hemorrhoids, viral hepatic phases, so very important to know. Incubation, you don't see any symptoms, but you're making the virus. Prodromal is like you see the actual symptoms. Preectic is you're not turning yellow yet. Icteric is that you turn yellow now. Recovery is recovering. Enteric is that you're yellow, you're due to build up of unconjugated bilirubin. Since hepatocytes are damaged, can't conjugate bilirubin anymore and can't produce bile. Fat is not able to be digested, indigestion, diarrhea, and malabsorption. Hepatomegaly, infected liver, inflamed, splenomegaly, bulimetical, and liver backs up into the spleen, portal hypertension, dark urine yellow poop, total bilirubin. Alright. I think I got a really good idea of Hep A, B, and C. We'll go over it one time. Hep A, the vaccine's available. You have so many variants because it's hard to treat because it's an RNA envelope. So the has said CAD. Vitamin C lasts the least amount of time. A is the next last, and then B. And then who affects people that are traveling, immunocompromised, chemo patients, is a fecal oral, needs food and hygiene, hand hygiene, sanitation. Severity is mild, produces IgM, then IgG, protective, shows prior infection or vaccination. Chronicity, you don't get cirrhosis, you always recover. Hep B is the longest. You can get an immunization for it though, because it's DNA enveloped and it stays the same over time. You can get IVIG antibodies to provide immediate protection, but it takes 2 weeks to work. Its incubation is the longest, 60 to 150 days, average is 90. Longer because the envelope and immune system doesn't know it's there. It can evade the immune system because it has a cell membrane and stays undetected. So IV drug users, it's hepatitis B is like needle stick injuries, dialysis. Yeah, you can also get it from IV drug use, either asymptomatic. You can have it and lay dormant with it for a while. Parenteral, sex tattoos, needle stick, saliva, birth for mom and baby. B for birth. Severe though. The severity of the symptoms are very severe. You get hepatomegaly with this one, for upper quadrant pain. 10% with or without cirrhosis. There's a lot of carriers, can stay dormant, asymptomatic, but still spread. For Hep C, HCV RNA test. There's no vaccine available at all because there is an RNA envelope. Any RNA envelope, so much mutations. It mutates way too much. Technically, hepatitis A is like COVID or anything like the flu. It's RNA enveloped. But hepatitis C is RNA with no envelope here. And hepatitis C is with envelope. So it mutates a lot. You can't get a vaccine if you already have the virus, though, because there's no available anyways. 14 days. So the incubation is the least amount. So yeah, you literally takes 14 days for you to see the virus after. But that's a good thing in some way because you can see that you have it in your blood faster. Hepatitis A, it'll take more than 2 weeks to actually know you have it. Hepatitis C, specifically IV drug users, you can't really lay dormant with it. You have it or you don't. It's pretty obvious. But you don't have that many severity of symptoms. You have jaundice, dark urine, liver function is low, dark urine, again, yellow poop. You cover and clean wounds. You use clean needles in screening. Same thing as the other one. Even birth, I guess, for this. 50 to 60% though gets cirrhosis. So it Hep B, there's 10% chance of cirrhosis with or without. But hepatitis C, you most likely will always get cirrhosis. You also get thrombocytopenia, which is low platelet count, skin bruising, liver enzymes. Let's explain a little bit about hepatitis a little more. So I just want to go over this. Hepatitis is on the surface. You'll see it shows when you're recovering. It's basically the actual immune immunization that you get, and it only affects the surface of the hepatocyte, and so it guarantees lifelong immunity, and it shows recovering. If you see antibodies, if you see HBsAg, so the antigen comes here, that means like a implanted virus given to you. And if you get hepatitis surface antibodies, so anti-HB, then you basically have antibodies that fight it, so you're immune. Then you have IgM. Basically, it's at the core, and it shows an acute infection. And then it becomes seroconverted into IgG, which is a protective. You get immunity this way. And it shows that you had a prior infection. If you had IgG, that means you had a prior infection or you had vaccination. So even IgG will show if someone was birthed from a mom. Hepatitis surface antigens we talked about. Hepatitis surface antibodies for that. Hepatitis core antibodies are only made if like you get the real virus, basically, or you have a current infection. Okay. Hepatitis surface, so surface antigens show that you have active infection. You have an active infection going on. It could be either from an immunization, or if you are having a chronic situation, it will always be high. That means you have the actual virus. Very bad. Hepatitis S, basically SAB is like antibodies against hepatitis, and that basically means on the surface you create antibodies, and you bring down the virus number. It's basically showing that you have recovering or have immunity. That means you've been vaccinated. If you have hepatitis surface antibodies injected, yep. Hepatitis core antibodies you're not able to detect, but it's basically antibodies made against you getting a real infection, current infection, or previous exposure. It's good to have the core antibodies though. Would not be present if vaccinated. Would not be present if it's vaccinated though. Core only produces antibodies if there was a real infection. Antibodies against surface antigen are due to vaccine. So this only happens if you had immunization. This only happens if you had a real vaccine though. Sorry. This only happens when you get the real vaccine. This only happens when you get the vaccine. And this happens when you get the real ass virus, hepatitis. IgM is a recent infection. Goes away in 2 weeks. And then IgG is basically saying it's been seroconverted. That means you're immune. It's either resolved or it's chronic. Yeah, if you see a chronic infection, you'll see that it's always an active infection. It always stays high. For hepatitis surface antigen, it will go and go down, but the core antibodies will stay high because you had a resolved infection. So you'll see here, I don't have to go through that because I already kind of know. Now let's look at liver situations. Okay. So liver and cirrhosis. So liver disease can be genetic, retaining fat and lipid. Example is hemochromatosis. It also can be due to the lack of alpha-1 antitrypsin. Cirrhosis is basically a bunch of scarring and fibrosis due to the hepatocyte death. It blocks sinusoids and bile calculi, causes liver insufficient function and portal hypertension. Hepatocyte destruction causes a loss of function in scar tissue, so low scarring and fibrosis not great, and constant chronic inflammation causes cirrhosis eventually. It could be due to the hepatitis in B or C, or an underlying cause like alcohol causing hella irritation and inflammation. Cirrhosis is due to alcohol, hepatitis, viral, and biliary disease, so we talked about this in a little way. Only way to actually resolve this is by giving a transplant to the person. So a bunch of inflammation causes fibrotic situations, forms scar tissue, happens from viral hepatitis or alcohol. Cirrhosis is irreversible, basically. And basically the end stage liver damage You can also check this out by doing liver biopsy, and you'll see bumpy nodes on the liver. It increases the pressure in the portal veins, and so you'll see like fluid gets pushed into tissues and across them into open spaces like the peritoneal cavity, because the sinusoidal veins have too much fluid. And there's hypoalbuminemia because the liver usually produces the protein albumin. And this all causes ascites. So blood flow goes into the esophageal varices, blood flows in the gastric veins, hemorrhoids, also in the stomach. Liver naturally receives deoxygenated blood from intestines. Stomach and spleen receives oxygenated blood from heart. Us basically having portal hypertension causes hepatomegaly, and then hepatomegaly would cause splenomegaly. Splenomegaly causes a whole lot of shit, like renal resistance, decreased blood flow to the kidneys, hepatorenal failure. So it's renal failure due to the origin. So liver failure causing renal failure. So CKD can happen also because of liver failure. So having low blood flow to the kidneys is another problem because RAS is activated. You have more fluid retention, you have edema in the hands and the feet. Let's go a little bit more. Liver dysfunction causes chronic liver inflammation, causes liver disease. A lot of scar tissue because body is fighting off infected hepatocytes. Liver is unable to do regulatory functions, causing cirrhosis. ALT and AST enzymes are leaked out because of death of hepatocytes. More ALT and AST is a problem. Ooh. Alright. Having liver disease. Viral hepatitis is preventable. And also chronic inflammation can cause fatty liver disease. So fatty liver disease can happen. You need to have diet and exercise because the liver cleanse won't work. There's a buildup of fat in the liver because then you know how liver with cholesterol, it helps to metabolize cholesterol. Liver disease can be genetic. End-stage liver disease though shows there's more AST than ALT, which is really sad. So that would show like the most hepatocyte death. Hepatitis makes sure you vaccinate. Reversible. Cirrhosis, liver condition, abdomen, confused mental state, internal bleeding, heavy scarring of liver, loss of liver enzymes or liver cells, hepatocytes, decreased blood flow through the liver, can't regenerate. Liver damage is different than cirrhosis, so you're drinking casually. Acute alcoholic cirrhosis is no big deal. Car accident hurting livers is a one-time trauma. It's just damage. Damage is different. Liver damage, taking that time enough. Even an overdose, like a NAC, could help with that. But the thing is, liver damage from a one-time overdose is no big deal. It won't cause cirrhosis. But mid-toxicity, let's say for metformin, Tylenol, or like a lot of medications constantly can cause cirrhosis. It's chronic. Anything cirrhosis is chronic. Biliary obstruction due to gallstones and bile bags into the liver. Patients with compensated liver failure have no interruption with their ADLs. In cirrhosis, it's a chronic thing happening, and repeat injury, drinking constantly, a lot of exposure to alcohol. You get alcoholic cirrhosis, alcoholic hepatitis, alcoholic liver disease, basically hella infection, secondary to infection. A lot of inflammation secondary to infection. Toxins, hepatocyte death, you have viral hepatitis, non-alcoholic. It's more B and C because we talked about how A doesn't really lead to cirrhosis. Non-alcoholic converts nutrients into fat deposits, fatty liver disease secondary to obesity, diabetes, causes portal hypertension, blood backs up into digestive organs. Older patients, secondary to liver damage due to life over time. Constant metoxicity, we talked about that. Cardiac cirrhosis would start the heart due to basically wherever the origin is. The heart backs up blood into the liver, because it does that, through the inferior vena cava. Autoimmune disorders, we talked about hematocrosis, with the iron buildup, body constantly attacking itself, like the alpha trypsin AAT deficiency, hematochromatosis. Another thing would be congenital, born with low bile ducts. Yeah, so we talked about NAC. Although it helps with COPD to be a mucolytic, it also is an antioxidant for overdoses. Liver is not doing normal function, so you can detox, so toxins flow freely in the blood and brain. You get mid-toxicity from Tylenol, you get just dose of pharmacy, you have ASD, ALT, and AFT. ASD, the most in the end, causes problems. Hepatic encephalopathy, blood pressure and heart rate, very confused. Make sure you have low protein intake. Lower gut bacteria by taking metronidazole. Gut bacteria. Need lactose therapy, a lot of fluids to prevent dehydration. Secondary to ammonia, producing GI from eating protein. Ammonia dissolves easily in blood and crosses blood-brain barrier, CSF. Not able to convert ammonia to urea, that's why you can't pee it out. You have to eventually poop it out. You get many types of toxins to the brain, causing asterixis. Check lights to rule out the source, and you can also cause coma, so this is always a priority. Can metabolize estrogen, so you have hella estrogen in the body, you get man boobs, you get spider veins in the stomach, you get smaller testicles, you get red palms, because of estrogen. You can't conjugate bilirubin, so that's why you have unconjugated bilirubin. You have bilirubemia, causes jaundice, causes pruritus, causes poo-poo, causes dark urine, pruritus. Can't produce albumin, so you have hypoalbuminemia. You have edema, ascites, abdominal and lower limbs, blood pressure, heart rate, shortness of breath, nausea, vomiting, low appetite. Also increase secondary to aldosterone increase. You have more ascites. Sodium restriction, spironolactone is very important. Diuretics, paracentesis, daily weights, abdominal growth measurements. More than 2 grams per day and more than 5 pounds per week. You can be clotting factors, so for fibrinogen, so you have thrombocytopenia, which is low platelets, and you have a high risk for bleeding, so you have easy bruising, GI bleeds, and stomach is a high risk. Can't convert glucose to glycogen, so not able to store, you have hypoglycemia. Because you can't really use up any of the glucose that's there. Can't synthesize cholesterol, so you have a lower of a good cholesterol, so you have bad cholesterol running around, bad liver disease. Can't produce bile, so can't emulsify fats, can't dissolve vitamins. You have fatty stools, vitamin deficiencies. Negative multivitamin. Hypocalcemia because vitamin D not activated, vitamin K not activated, increased risk of bleeding. Lactulose. And then for liver, for percutaneous liver biopsy, take a shit test, bleeding, put all the person on the side that they're actually getting the site of the blood. Pain, bile leak, peritonitis, make sure you have antibiotics, metronidazole, and also metronidazole to help eliminate gut bacteria that would cause hepatic encephalopathy. Liver failure. Basically disorders the synthesis of storage functions, glucose, hypoglycemia events, proteins, hypoalbuminemia, you get ascites. Proteins cause decreased coagulation. We talked about thrombocytopenia here. And albumin problems. Lipoprotein, so you'd have decreased cholesterol, bile cells not able to absorb fat, deficiency of vitamins, fatty stools, weakness. Now you have disorders of metabolic and excretory functions. You have amino acids, steroid hormones, drugs, bilirubin, impaired amino acids, so impaired conversion of ammonia to urea, encephalopathy, steroid hormones, increased aldosterone causing ascites, so liver failure increases aldosterone as well. Because liver failure causes the kidneys to think they're not getting enough perfusion. Steroid hormones, increased androgens, estrogens, gynecomastia and testicular drug interactions and toxicities, hyperbilirubinemia, so you have jaundice. Portal hypertension is caused by increased aldosterone, edema, increased aldosterone, hypoalbuminemia. So not enough albumin, hella aldosterone causes portal hypertension. And then increased pressure in the portal vein pushes fluid into abdomen, so you have beta blockers used to manage the hypertension part of it. You have increased pressure in peritoneal capillaries. You have ascites. Ascites can lead to hepatomegaly, splenomegaly. You have rare recorded pain is tender. Splenomegaly is leukopenia. Talk about it in a sec. Spontaneous bacterial peritonitis. Rebound tenderness hurts when you release than apply pressure. Ascites increases bacteria buildup in the body. Peritonitis. You need metronidazole. Or rifaximin or neomycin. So yeah, rebound tenderness, so spontaneous bacterial peritonitis. You get a fever, check the white blood cells. Your rebound tenderness hurts more when you release when you apply tension. So rebound tenderness. It hurts more when you release than applying pressure. Hepatorenal syndrome, basically liver and kidney will think it's fluid deficient because pressure of ascites impedes renal arteries. RAS activated, sodium aldosterone retained, increase basically parasympathetic. Good daily weights, goal to decrease blood pressure in and out, check in and out, fluid sheets, diuretics, fluid restrictions, parasympathesis, signs and symptoms of infection. Look for lights, creatinine, urea, albumin. Now, portal systemic shunting of blood, development of collateral channels, caput medusae, hemorrhoids, esophageal varices, painful stool softener. It's engorged veins. You need vasoconstrictor here. Put someone on PO. You want to make sure they have soft foods if anything. Difficulty swallowing, don't NG, don't deep breathe and cough with them for esophageal. Hemoptysis, you'll still blood, maybe dark red because you have blood, you're eating it. Bleeding risk, hypovolemia, IV site hold down longer. If it's in the poop, it's going to be a hemorrhoid situation maybe. The splenomegaly, you have to check the PTT INR because they'll have anemia. So that means low hemoglobin. Leukopenia, so low white blood cells. And thrombocytopenia, so low platelets. Secondary to splenomegaly, thrombopoietin production by liver, hepatocytes, bruising, petechia, you get a lot of bleeding. Avoid invasive procedures. Let's talk a little bit about thrombocytopenia. Yeah, so thrombocytopenia is from cirrhosis, viral hepatitis, decreases bone marrow production of red blood cells, basically. Protect someone from trauma, any kind of items or catheters, Stop giving them ASA because their platelets are very low. It increases the risk of bleeding. Check differential, bone marrow biopsy, increase the platelet count by IVIG or platelets. Actually, I don't think you need IVIG. You need to give them actual, like, I don't know, frozen plasma. Yeah. Corticosteroid, folic acid to increase bone marrow to produce more platelets, platelet transfusion. Don't give it if it's heparin induced. Thrombocytopenia though. So someone on AFib and they got heparin for warfarin bridging and then they end up getting thrombocytopenia, you don't give a platelet transfusion. Splenectomy, if it basically a stop platelet sequestration. Plasmapheresis. I don't need to know all of that, but yeah. You need to know specifically that thrombocytopenia happens when there's low platelet production, increased platelet destruction, or splenic sequestration. So not enough platelets being produced with bone marrow maybe. Liver is not making thrombopoietin. And then platelets destroying a bunch of them, and then or using them up. Or splenic sequestration is just a bunch of them are held in the spleen.